bringing young people into this conversation around substance abuse and addiction, could be quite radical. But many people, may think the opposite as well, and that's just following on that idea of that bringing young people in early could actually be a safer and more effective way to tackle it. So there's lots to think about there.
Harm reduction, yeah, I think that's what we call it. For me, the standout session was really about improving road safety. That was really surprising. Those numbers are shocking. One adolescent in youth death every 2 minutes around the world, that is completely unacceptable. But please keep engaging on social media. We'd like to hear your thoughts, your perspectives, and your ideas in terms of how you're finding the respective sessions. Use the hashtag 1.8, that's 1POINT8 across all social media platforms, and we'll be following all streams, really trying to keep track of what you're saying, what you're liking, and what you want to see more of during the course of today.
That's right. I'm so excited for the rest of the sessions. And I'm about to tell everybody what a couple of the next sessions that are coming up are. So now for our core session, that's this morning. One is about resilience and one is about investment. Now, the first one is called If Only You Would Listen, a conversation between adolescents and global experts on building resilience in an uncertain world. The second is called Invest We Must. The time is now, making the case for adolescent well-being. And well, I think that title says it all.
I'm really loving the sense of urgency in all of these titles. They're very timeless. Now we have some great content for you, and we hope you'll enjoy listening to the wonderful poet, Sammy Rhymes, who performed recently at the legendary Glastonbury Festival. She's performing the 1.8 billion campaign poem, and she is definitely going to blow you away with this poem. And then we have some excellent pieces of content from incredible events from the African continent. So we're heading to Ghana and Zimbabwe. See you in an hour.
Great to be here. I just want to give a big shout out to the White Ribbon Alliance for having me here. So I'm here to share a poem today, capturing the voices of 1.8 billion young people out here today. They've got a lot to say, and I just wanted to capture that peacefully for a protest through this poem. And it's called 1.8 billion strong, simply because their voices are powerful, and I really hope I capture this through this poem. So here goes. A young mother in the camps told me they only turn the lights on twice a day. Once at dawn when they get up to pray, and once towards the end of the day. An opportunity to put the darkness away, tackle the suicidal thoughts and put the trauma at bay. The children didn't have too much to say, other than the fact that they're grateful for being able to break fast every day, walk to school and back home to play. They say they know these hard times aren't here to stay, and that they are going to make changes one day soon, as soon as they make room at the table and start to listen. The people in charge have long been abusers of power that's given. It's only the same power cuts could be applied to corruptors embedded in the system. The first task of any leader or politician is to ask, and the second is to listen. We want transparency on the hidden, everything from the cost of living to the cost of giving, because too many are living below the line. Many say they are okay, but they are not fine. Physically unwell and mentally in decline, and even in these times, our girls are undermined and marginalized. Education's been cast aside for 12 million worldwide underage brides who are forced to loosen up when things are tight and tight because money is tight. Considered a burden, sold off or sterilized by surgeons through coercion, captured and moved from rural to urban, sold to a man more than twice her age, understandably full of rage but silence, living cage but bearing the brunt of violence, becoming stock during climate shocks and health epidemics, lacking access to menstrual products, prescribed pills and medics, going through pandemic after pandemic, and life is far from epic for those who only venture out to shore, an adventure where mother and child remain unsure of destination, passing ports only to be captured by immigration, fleeing from famine living in war-torn nations, seeking freedom from oppressive obligations enforced by leaders running corrupt corporations. Many want to lead, but very few successfully do it without meeting an axe or a bullet, assassinated from close range for bringing about change. And if things are to change globally, we need to openly converse with the youth and consult them when we set goals. For they are currently left out in the cold and underrepresented in polls, governed by souls with self-serving goals. We need to involve more Malalas and Gretas, have policies shaped and led by Gen Z, for they are the generation of go-getters. In this rat race, they are the pace setters, running around trying to make the world better. And those in power should know better but to turn them away. Let them have their say, for they are the voice of tomorrow and the voice of today. 1.8 billion strong, with opinions of what's right and what's wrong. Powerful voices. They want consent and childbirth choices. They are tired of being raped, trafficked and exploited, often ignored and undervalued. Despite bringing so much value, they demand inclusion, equitable distribution, and push for the evolution of environmental friendly, sustainable solutions. But we need a fusion of experienced allies and young advocates to collaborate and find these solutions. We are 1.8 billion strong, with opinions of what's right and what's wrong. We have tactics and we have tongues. Don't dismiss us because we're young. Let us unite, rise and lead. Let us plant the seed, for there is nothing about us without us. Listen to our plea. Thank you.
Oh, Sammy, thank you so much. Gosh.
The internet is the invention of our lifetime. It's the thing we turn to for the answers to almost anything. Now, imagine not having it. Around the world, mobile phones are bringing people closer to being connected. But the truth is, not everyone can afford the data bills, especially those in hard-to-reach areas. There's a big gap, and the Internet of Good Things is working hard to bridge it, bringing locally relevant, life-saving information and educational content closer to the people and communities who need it most, for free. And it's working. The Internet of Good Things is helping parents in the poorest and most remote areas provide the best care for their children. It's empowering young people to understand and defend their rights. In emergencies, it's a valuable source of real-time information, and around the world, it's providing a voice to the community. Through partnerships, the Internet of Good Things has the potential to reach 1 billion people. But to close all the gaps, we need to build a lot more bridges. With more people on board, more communities can be connected, and more lives will be changed. Internet of Good Things. Live better today.
Good day, everyone, and welcome to the National Youth Forum on Adolescent Health and Wellbeing. This is one of over 100 national events leading up to the Global Forum. The goal of the Global Forum is to make sure the world takes us seriously and that our well-being and health are a priority. Working with mobilizers to hear what the young people want through the 1.8 billion campaign, our leaders must address these issues.
And to improve my well-being, I want the government of Ghana to reduce all the taxes imposed on sanitary pads to allow all girls to be able to access it.
And to improve upon my well-being, I would like more police stations to be set in the rural and urban areas to help create a safe environment for girls. Thank you.
To improve my well-being, I'm pushing for there to be better roads for our young people to be on. Thank you.
To improve my well-being, I want to live in a community which provides me with a housing system where I feel safe and secure.
As part of my well-being, I would like there to be more accessible and more friendly healthcare services, especially for young people in Ghana.
We are from Zimbabwe. We are part of the 1.8 billion voices of young people campaign.
Hey yo, what's up? My name is Leon Tinasha Mateo, all the way from Zimbabwe. As young people in Zimbabwe, we dream of a country that includes all young people in all its decisions, because anything without the total involvement of youth is not for youth. Thank you.
Hi guys, my name is Diana Manditsera. According to the Constitution of Zimbabwe, we have the right to health, but however, how can I have the right to health without water, without sanitation? Month by month, I face challenges, especially when I'm on my menstrual cycle. So, as individuals and community and the government at large, it is our responsibility to ensure that there is good water and sanitation.
Hello, good morning, good afternoon, good evening, wherever you're joining us from, somewhere in the world. My name's Mark Hanson from the University of Southampton, and I also chair the Knowledge and Evidence Working Group of PMNCH. And a very warm welcome to you all to this session called Invest We Must. The time is now, making the case for investment in adolescent well-being. So I have some really exciting news for you, because today we're launching the interim summary of our investment case, Adolescents in a Changing World, the case for urgent investment. Over the last year, PMNCH and Victoria University in Australia have been working to develop an adolescent wellbeing investment case, and it's based on the 5 domains of adolescent wellbeing. That's good health, connectedness, safety, and a supportive environment, education, and agency. This, of course, was a huge undertaking, and it involved revising, updating, and expanding previous models for investment, reviewing and updating all estimates of intervention costs, and then developing a global modelling tool for investing in adolescent well-being, which can then be field tested in countries around the world. And today, for the very first time, you are the first people to see the interim summary of this report, which we are launching now. So our session is going to focus on presenting the key findings and the advocacy asks of the adolescent wellbeing investment case. And it will include eventually a suite of models to support member states to develop their own investment cases. So the session will explore the implications of cost-benefit methodologies for promoting the well-being of adolescents at the global, regional, and national level through NGOs, through youth networks, academic institutions, UN bodies, as well, of course, as local governments. I'm joined today by Peter Sheehan and Bruce Rasmussen from Victoria University, who were the architects and the leaders of this piece of work, and they're going to be presenting that to us in just a minute, along with a wonderful list of speakers who will also join us to discuss issues and answer questions. Surabhi Dogra, who's a youth commissioner of the Second Lancet Commission on Adolescent Health and Wellbeing, very influential publication. Daniel Chisholm, mental health specialist in the Office of the Director, Department of Mental Health and Substance Use at the World Health Organization. Bui Ini, who's a from Girl Advisory in the Adolescent Girls Investment Plan, and she's based in Vietnam. Mona Ibrahim, who's a researcher and policy advisor for the UKRI Global Challenges Research Fund Accelerator Hub, and she's based at the University of Oxford in the UK. And last but not least, Don Bundy, who's Professor of Epidemiology and Development at the London School of Hygiene and Tropical Medicine, and he's director of the Research Consortium for School Health and Nutrition. So without further ado, I will hand over to Peter and Bruce from Victoria University, who will walk us through the key findings of the interim report. Note, of course, that this material can be quite technical. So if you've got any clarifications that you'd like made, please pop your questions into the chat and the team will endeavour to answer them as we go along. And I hope that we'll have time for more general questions throughout the session. So that's it from me for now. Over to Peter and Bruce to tell us about their findings of their work. Thank you.
I'm Peter Sheehan, here with my colleague from Victoria University, Bruce Rasmussen, to introduce this session on the investment case for adolescents. Adolescents today face severe challenges in a rapidly shifting world. These range from rapid changes in population and the impact of climate change, to the learning crisis and persistent inequality, to violence, and to the neglect of human rights, especially for women. Even so, the emerging generations of adolescents remain the hope of the side. More attuned to the emerging realities, they offer hope and energy in the face of the fear and lethargy in many quarters. They will emerge as the leaders over coming decades. The world urgently needs a new investment program to improve the well-being of adolescents and to help them prepare for that future leadership. The costs of inaction are very high to individuals, communities, and the world as a whole. This investment must cover all five domains of adolescent well-being shown in the slide and the linkages between. It must respond to the expressed needs of the adolescents itself. It needs to be a global program carried out at the local level, with the initiatives tailored to the realities of individual countries and to the people, young people involved. In our view, again, as shown in the slide, transformative investment in three key platforms was necessary. Universal health coverage, including primary care, enhanced schools that focus on learning, health, nutrition, and student well-being, and support systems based in local communities. These platforms are not only key points for program delivery, they are essential to ensuring that all adolescents are covered and that the complex linkages between the programs are fully realised. This means major investment in health services accessible to adolescents without the constraints of income, gender, region, or ethnicity. In programs to reduce dropout from school, to sharply improve the quality of learning while enhancing school programs in key areas such as nutrition and mental health, and to building out the many platforms at the community level which are vital to adolescent well-being in areas such as parenting, interpersonal violence, and road accidents and other injuries. Critically, these are not investments in separate silos, but in interactive platforms working together to achieve linked benefits for adolescents. It is clear from our review of the literature and from new modelling work undertaken for this report that the economic and social returns to a wide range of investments to address adolescent well-being are very high. The quantitative measure that we use to report is the benefit cost ratio, the ratio of the value of the benefits achieved to that of the cost of the investments necessary to achieve those benefits. For a wide range of investments analysed here, the BCRs are 9 or above, with much higher values in many cases. An investment in which the benefits are 9 or 10 times costs is a very strong one indeed. The case for investment rests not only on these quantitative metrics, but also on the fact that they will reduce inequalities and help to protect the human rights of the adolescents. Bruce.
It will be obvious from these results of the investment analysis that they cover some, but not all, aspects of adolescent wellbeing. We have better coverage for education, health, including mental health, and some aspects of violence and injuries, such as child marriage and road traffic injuries, than others. If we look at the chart summarising the domains of wellbeing, we can see that two of the domains, connectedness and agency and resilience, do not have return on investment results. Both are conceptually very important for adolescent wellbeing. The fact that data limitations restrict the application of this style of investment evaluation adopted in this report should not be taken as in any way diminishing the importance of these domains for adolescent wellbeing. Peter.
We have identified in this study 6 priorities among the many that could be highlighted. The first noted here is malnutrition. There is a body of literature which shows that the various dimensions of malnutrition, undernutrition, micronutrient deficiencies, and overweight obesity all impact strongly on adolescent health and learning. Strong international programs have been developed to drive investments in these areas with the support of key global agencies and researchers. One striking example is the School Meals Coalition program. Such programs need to be a central part of the investment work. The second area we highlight is learning, skills, and employment. This is obviously a critical area for many reasons. Learning and skills touch almost every issue: health and empowerment, child marriage and unintended pregnancies, employment prospects, and so on. Education, employment are the prime issues raised by adolescents themselves in surveys such as the recent one undertaken by PMNCH. The evidence reported in this report is that systematic investment in proven interventions can have a major impact on these key outcomes.
Mental health is the next one. Mental health represents 13% of the total disease burden for adolescents, one of the highest causes of disease for adolescents. It is a bigger problem for young women than men. There are wide disparities between countries. It is worse in countries with instability and terrorism and with unemployment. Many intervention programs target bullying, depression, and anxiety and substance abuse. One that has been analysed using rate of return methodologies is socio-emotional learning, a school-based program which has had success in reducing such aspects of mental health. Regrettably, most of the studies, with at least one important exception, has been situated in high-income countries. Next is we've listed is position of women. The disadvantage experienced by adolescent girls ranges from implicit discrimination to violent injury and premature mortality. Intervention programs to address this disadvantage, including developing and affirming human and civil rights, working in communities to change cultural and social norms, and implementing practical programs in health and education. Some of these, such as child marriage, sexual and reproductive health, are the subject of investment. Return evaluation studies conducted for this report, they illustrate the generally high returns from investing in programs to improve the well-being of young women. The fifth is the prevention of violence and injury. Adolescents face heavy burdens of violence and injury. These include child marriage, intimate partner violence, and other interpersonal violence, transport injury, suicide, and other self-harm, and violence related to war and terrorism. These affect young women and men differently. Young women suffer through child marriage, intimate partner violence, abortions, and genital mutilation, often made worse by war and humanitarian crises. Young men are more adversely affected by road traffic accidents, interpersonal violence, and active participation in war and terrorism. The report makes clear the high value of investments to reduce the impact of these causes of severe stress. Peter.
We started with the theme of the challenges adolescents face as the future evolves. Countries and agencies need to consider how they can assist young people in meeting these challenges. Two key points seem apparent. One is that connectedness, agency, and resilience are critical to dealing with shared problems, so that these domains need priority. The other is that there is evidence that involving adolescents in working with their community to addressing challenges is beneficial to their welfare. So the inclusive nature of the investment program is also crucial. Thank you very much.
Thank you both very much for that very clear presentation, and of course for doing all the work which has led up to this interim report and of course the full report. The figures that you quote in the report that you've come up with are absolutely eye-watering. Can I just check that I've understood this correctly, that the countries that you've looked at would cover about 85% of the world's population of adolescents. So in other words, your conclusions are not just a little niche area. These are truly global issues and global figures that you've come up with. But if we take the cost of inaction from 2024 to 2035, you're calculating that it's at least $20.5 trillion US dollars, equivalent to the GDP, about 6% of the GDP of these countries that you've studied. In other words, if there isn't investment to promote adolescent health and well-being, the detrimental effects of this inaction will just wipe out any increase in productivity and global wider health and well-being. They'll wipe out the GDP. Am I missing the point, or is that essentially at the highest level what you found?
Mark, is that a question to me, or?
Yes, that's a question to you, or to either.
Okay. Well, broadly speaking, what you say is correct. These adolescents face very severe problems, and if they're not addressed, the costs of not addressing them are very high and will impact on their GDP and obviously impact on the adolescents and their communities themselves. But of course, the other part of the key part of the report is there are things we can do so that we know work and will be effective. So this is an investment case and a call not to do nothing, but to get together and take effective action to address the well-being of the world's adolescents.
Thank you. The other question I wanted to ask you was, you listed the areas where action was particularly needed. I'm assuming that they probably weren't necessarily in order of priority, but it was very interesting that at the top of the list was malnutrition in all its forms, and you rightly pointed out that that could be micronutrient deficiency or undernutrition or overnutrition and obesity. And then secondly, training and education and skills promotion. And it's interesting that the PMNCH What Young People Want campaign, which has looked, I think, at more than 1 million answers now to that simple question globally, very much comes up with those two things as high priorities. for young people, the need for training and investment to give them better employment prospects and a better future, and health and well-being, in particular nutrition. So do you have any thoughts on those priorities, or do you think we need to see them all together? Can we start from number one and then work down, or do we really need to put this into a package for action?
Well, we've seen it a bit more as a package for action, but we note that certain issues are priorities. Malnutrition has enormous ramifications through the adult development process, and adolescence is a time of very remarkable change. So it's not surprising that nutrition has all sorts of adverse effects, of bad nutrition. And education, again, ramifies everywhere into health, how well people look after their health, into their ability to find decent jobs and so forth, and their ability to look after their mental health. So I wouldn't want to say, there are only these, but they're a pretty good couple to start with. Mental health is another one, which is enormously important. And a very important part of this report is that so many of these factors are linked to one another.
Yeah.
And we haven't given enough attention in the past. We tend to treat everything in silos. We haven't given enough attention in the past to how they link and interact with one another.
Thank you very much. Let me bring some of our expert panelists in now. Sarabi, I hope you're there. We'd be very interested to hear, reflecting on what you've heard, how the ideas in the report might relate to the work of young people that you've been engaged with in India. I was thinking actually of Prime Minister Modi's comments at the end of the G20 summit, which he, of course, chaired a few weeks ago, that nutrition was very much part of the future in relation to India's Nutrition Month, but also a focus on women. So does what you've heard jive with that, and do you see resonance in India, and will this provide a way forward?
Thanks so much for that question, Mark. And as a young Indian, I feel that the cost of inaction is the cost of failing to address the well-being of over 253 million Indian adolescents. Globally, adolescent well-being, we know, is at a tipping point. And with one of the largest population of adolescents globally, India too needs to ramp up investments to meet the evolving needs of adolescents in the country. Over the years, through policies, as you mentioned, the RKSK, for example, the Rashtriya Kishore Swasthya Karyakram, the government has expanded the focus of adolescent health from only sexual reproductive health to other strategic priorities, including nutrition, mental health, violence, which Peter and Bruce also highlighted as investment priorities in their presentation. So I think we need to keep pace with emerging threats as well as ongoing threats when it comes to the well-being of adolescents. We need to invest in moving the needle from planning to implementation, and that has to happen through the key platforms of education, healthcare, and community structures. The interim summary report also I found interesting. It highlights the cost benefit of transformative investments in school-based initiatives. And I found the Seher study from Bihar to be an important example from India, illustrating the need to scale up interventions to improve school climate and that how it has benefits for mental health and school connectedness. But if I think of Bihar, I also think of how adolescents are not a homogeneous group, but a group with diverse lived experiences. Some of you may know that the caste census of Bihar has only come out recently, and the last one was carried out back in 1931. I think it's essential to rethink spending to cater to the needs of the most vulnerable adolescents. That's adolescents facing discrimination on the basis of caste, religion, gender, and income inequality. Adolescents from marginalized households are forced to weigh the cost benefit of either continuing education or dropping out in favor of earning. And the climate crisis, as now we're seeing, it's further worsening these kind of pre-existing inequalities. We know that the COVID-19 pandemic and lockdowns disrupted education, health, and community services, and adolescents lost connection with these very integral support systems. So growing up in the era of the climate crisis, adolescents are faced with a higher probability of impending pandemics and building resilience in health, education, and community structures is important and pivotal to address pandemic-related disruptions that this generation will face, and that will ensure the well-being of adolescents now, as well as for the future adult life trajectories. And we cannot do this without including adolescents. The recent G20 PM&CH policy brief called for the G20 to prioritize meaningful engagement of women, children, and adolescents. And as the G20 presidency moves from India to Brazil, I hope that this recommendation will be adopted to ensure that adolescents can shape the narrative of their own health and well-being, not only at a global level, but also at local levels of decision making. So I'll just quickly wrap up by saying that policymakers have the choice to weigh the cost benefit of investing in adolescent well-being, but many adolescents do not have the luxury of making that choice. The cost of inaction will have to be paid by an adolescent who has to give up on their dreams of a better livelihood, and an adolescent made to drop out of school, an adolescent forced into child marriage, an adolescent who had hopes for a healthier life and better future.
Thank you very much indeed. I mean, well, India is the largest country in the world, I think I'm right in saying. So you can do it. I mean, after all, you put a rover on the moon when I think some other countries failed recently. So look what India can do. And I think the issues you raised there are really extremely important. I'd like to bring in Dan Chisholm now, because a couple of our speakers have mentioned mental health, but I don't think we've addressed that specifically yet. So Dan, how do you feel that your work in WHO and WHO agenda more widely might be able to use this report and the investment case to drive the agenda for better mental health in young people?
Great. Thanks for the question, Mark. And hi, everybody. Yeah, very pleased to be joining this session today. And okay, I am a bit biased, I admit. But I am really pleased to see the central attention given to adolescent mental health and well-being in this work, because, I mean, along with childhood, adolescence is such a critical phase of mental capital formation or development. So, in fact, all and any investment in policies, programs, services to promote and protect mental health is money well spent. And I think, you know, as eloquently pointed out by Surabhi just now, I mean, over the last few years in particular, there's been a constellation of risk factors that, you know, really pose serious threats to the mental health and well-being of adolescent populations around the world. So I would say my first, you know, kind of point of reflection is that we really must, and national decision makers must see action in this area as an investment, as a genuine investment, and not as a cost to society. And so I think this is why the evidence that's you know, presented today is so valuable. It shows in kind of hard monetary terms the expected returns to such investment, both in terms of health outcomes, but also social and economic outcomes around, for example, improved scholastic performance, and even increased work productivity into adulthood. So that's really important to include those other outcomes, but also, you know, the benefit, if you will, of cost-benefit analysis is that, you know, because the results are all expressed in the same sort of simple, comparable way, you know, for every dollar invested, you get so many dollars back. We can see that actually mental health stands up very well in comparison to other areas, and that's obvious. That's often not the way mental health has been seen. It's been seen as not a good area of investment, but with returns of investment of over 20, you know, that makes it a bit of a no-brainer when you think about it. So one thing I want to just quickly say, you know, is around the schools. So, you know, in the WHO and UNICEF guidelines and associated Helping Adolescents Thrive toolkit, social emotional learning programs are one of the strongly recommended strategies. And in fact, we also recently published a global cost effectiveness analysis on this. So I was really pleased to see that social emotional learning features large here in the analysis too. So I think a real plea here for ministries of health and education to work together, and in some cases get their act together on developing and rolling out such programs. You know, they're not expensive, and as shown from the analysis, they generate solid benefits. So, Mark, you wanted to ask about how WHO uses this kind of evidence and analysis. So, of course, we use it both in a kind of advocacy sense, evidence-based advocacy in our policy dialogue with countries, but at a more technical level, we also would be able to add this to our increasing kind of armory or toolkit of evidence on the cost effectiveness and returns on investment. Several countries, for example, are already doing a national mental health investment case that looks at the social emotional learning programs. But my final point, and then I'll finish, is that just a reminder that when we're talking about investment, it's really important that we don't get just solely caught up with the economic argument. Of course, it's helpful, but when we put together a case for investment, we really need to also speak to other arguments, the public health argument, the equity and ethical argument, and indeed the human rights argument. And I think between them, you know, there really is a very strong, compelling case to do an awful lot more for child and adolescent mental health and well-being. So with that, I'll pass back to you, Mark.
Thank you very much indeed, Dan. And in fact, there was a question in the chat from Amy R, who's asking, how can organisations better invest to get youth and adolescents involved in societies, which will obviously help to promote their mental health, which leads me, I think, to bring in Nee from Girl Advisory, because I'm aware that sometimes the old guys like me can be preaching and it all feels a bit top down, and, you know, look, this is what governments should do, this is what adolescents need, this is what we need to invest in, and there we are, this is going to be good for you. It'd be really good to have your perspective, Nee, as to how this might jive with adolescents themselves, how this might be responded to. Is this something that actually will strike echoes and chords so that you as a part of the global population, you'll say, yes, at last we're being listened to, we really want this? Or is it actually not something that's wanted by young people globally? Nee.
Yes, thank you so much, Mark. Good morning, good afternoon, good evening, wherever you are. I'm Nee, a girl advisor at Adolescent Goals Investment Brand, Egypt, and a human rights youth advocate in Vietnam. So this is a pleasure to be here today and listen to the introduction of the report from PMNCH and Victoria University. So congratulations and thank you very much for a very informative report. So first and foremost, I believe that the report is highly relevant to the work at Egypt, because right just last month, Egypt published a report titled Investing in Adolescent Goals, Key Changes in the Bilateral Donor Funding Landscape 2021 update, which provides an overview of funding changes in the adolescent sector. And the report reveals that current funding levels do not meet the needs of low and middle income countries with a large adolescent population. And funding distribution is unequal across sectors and populations. And it also highlights the heightened risks faced by adolescent girls and the decrease in the gender and adolescent funding. And for the report presented by PMNCH and Victoria University, it also demonstrates that adolescent well-being is generally lower in lower income countries and socio-economic groups. And especially adolescent girls, they are at a much greater risk in all key domains. So for me, I believe that this information of the report really supplements and our existing evidence and strengthen ASIP advocacy work. And through a variety of activities, including working with policymakers and donors, we will try to keep promoting the recognition, the inclusion, and the investment in adolescents in all levels. So that is first for the work at Egypt. And regarding my country context in Vietnam, so due to time limitation, I would like to mainly focus on mental well-being of adolescents and how I find the report relevant to my context. Hope it's okay. So recently, I conducted a teacher training in a northern province of Vietnam under a mental health project that I'm in charge of. And I provided role-playing scenarios for them to practice when facing some case of student having mental health problems. And with what they perform and with their confusion and hesitation, it clearly indicates that teachers lack the necessary knowledge, the experience and skills to address these issues happening with their students. So that is very common in rural areas. In larger cities like in Hanoi, where I'm living, so last year we witnessed many cases of middle and high school students committing suicide caused by mental burden. So one of the most heart-wrenching cases, a student he even left a suicide note stating that suicide was not an impulsive act, and he had contemplated it multiple times, and it was his only way to escape from the prolonged pressures exerted by his family. So I'm giving this evidence to emphasize that the government and stakeholders should make greater efforts to find solutions to this problem, because people are still suffering, and especially adolescents. So that's I'm so very grateful to have access to this report, because it provides a valuable insight into adolescent mental health issues and effective intervention programs. So and for now, I'm very much eager to utilize this report as a resources to support my work, and I'm very willing to share this report widely to my network as well. And I hope soon that the government, donors, families, schools, and other stakeholders can drive concrete action and positive change. Thank you so much.
Thank you very much indeed, Nee, and more strength to your arm. That's great to hear that commitment. There was a question in the chat from Amy R, who was asking about one of the biggest lessons or challenges that you've met, and I think the issue of suicide as something which we're all beginning to realize is a huge problem, especially in young people, is one of the areas that we absolutely have to focus on. And thank you very much for bringing that up. So let's move to Mona. As a researcher and someone who's a policy advisor, are the messages coming through in this report, as you understand it, going to be helpful in advocating for more investment in this area, not just in the UK, but more globally?
Thank you, Mark. And absolutely, this investment is not just about showing the cost of inaction, but it also puts a number to the importance of working across sectors, including the ramifications of working in silos and how much they complicate our mission to improve well-being, especially in low and middle income countries. At the Accelerate Hub across our team, we've been working on identifying these multi-sectoral packages for adolescent well-being, including emphasizing the linkages across the 5 PMNCH domains. And evidence has time and time again shown that adolescent well-being is extremely interconnected. New research, for example, by Prof. Lucy Kluver and Assistant Professor Ilona Tosca showed that a combination of good parenting and economic support can reduce multiple forms of violence, including transactional sex, physical, sexual, and emotional abuse. And this is also mirrored in the report as well. And similarly to what Dan mentioned, we can also see how mental violence outcomes, suicide and road traffic injuries come across this report, but it kind of it emphasizes the advocacy benefit of using evidence to advocate for more investments into adolescents. The analysis emphasizes how investments can shape what our future looks like, and the key message I'm getting today is we have to start shaping this future today with adolescents.
Thank you ever so much indeed, Mona. I think those are really important points, and we look forward to the advocacy agendas and initiatives that will come out of this. So, Don, we've been hearing a lot of facts and figures and so on, but how do such analyses do you think actually relate to the challenges that the group faces? How can this work be aligned, for example, to other ongoing initiatives? Because usually, from my limited experience, if one can align a new advocacy case with an ongoing initiative or another policy agenda that a member state or organisation wants to take forward, it's a much easier way to go forward. So, Don, what are your thoughts on what you've heard? You're muted, sir.
I'm not now. Thank you very much indeed for bringing me into this discussion. I want to start with adding my congratulations to the suite of models that have been put together to achieve this. The whole area of adolescent health and well-being is a hugely neglected area when we look across the spectrum. And what's very special, in my view, about the work that's been done here, about this analysis in particular, is that it goes beyond cost effectiveness, because pretty well all of the interventions we talk about are cost effective, to ask the question, what's the cost benefit? In other words, what's the return on the investment? Because we can compare that then with other interventions. And what it addresses is the key question: is ensuring the well-being of adolescents a better investment than something else? And the answers are very clear. And actually, Mark, you gave a very emotional comment response to the scale of the numbers we're seeing here. An exceptional investment from the point of view of the individual citizen, an exceptional investment for society. But we can also see that ministries of health will be impressed with these figures, but even more so ministries of finance. And that's kind of key to our thinking across, what's the groups that get involved, because this is not just one sector. And I thought Mona's point about that was really important. This is a multi-sectoral response. In fact, if we think about what are the two important pieces here, one is that it's multi-sectoral, the other is that it's life-changing. Let's talk about multi-sectoral. We talk about well-being, about health and nutrition. But of course, one of the greatest crises that young people face today is around learning, not helped by COVID. And so here we have a major global crisis, something like $5 trillion actually being invested in learning right now globally. And without the investment in the well-being of the young people, that investment is just not getting leveraged. That's not going to happen. But we can also think of it the other way, and Dan made this point, that learning improves health, and socio-emotional learning specifically improves mental health. In other words, these two things are tightly bound up, and we could, if we had more time, talk about the links to social protection and gender in the same way. But I think we also want to make the point that this is a life-changing intervention because it happens at the transition from childhood into adulthood. We talk a lot about how important it is to invest in the first 1,000 days of a human being. We don't talk enough about the importance of then carrying on that investment into the 20s, or what we often call the next 7,000 days of life. That's when we pick up all our life skills. That's when we pick up all our training. It's also when we establish our lifelong habits, good and bad. It's early dietary preferences that determine the outcomes on obesity. It's those dietary preferences that determine whether we have planet-friendly approaches to diet. It's a key contributor to avoiding NCDs in middle age. This is a really crucial phase in our lives, and if we fail to invest in learning and well-being, then we miss out forever. Those are long-term terrible consequences, and they're consequences that have very significant economic importance to countries. The data, the World Bank data on human capital, which is what perhaps not very attractive term that's used for the ability of people to influence the wealth of their nations. We talk about in high-income countries, 70 to 80% of the wealth of the nation comes from the work of the people, whereas in low-income countries, it's only 30 to 40%. And that's a double tragedy, because it's not just about the GDP effect. It also means that in low-income countries, people are not able to achieve their full potential. So it's again, this is the emphasis that we need to invest in the well-being of individuals if we're going to get the kinds of returns that we're looking for. And on my final point, the analysis highlights 3 platforms: UHC, country programs, and schools for delivery. There's been mention already of the School Meals Coalition that came up after COVID. That means there is already a platform. There is already a platform out there that can deliver on all 6 priorities that were mentioned. So those are the points. The points I wanted to mention. Thank you very much indeed.
Thank you very much indeed, Don. And I think you summarised it beautifully. We've got just over 4 minutes left until the curtain will come down on us. I wanted to come back to our panel and ask you individually, just very briefly, if you've got any final thoughts that you'd like to share, particularly in relation to taking this forward with the advocacy agenda that we all need to get engaged with. Surabi, you first. Have you got something that you'd like to contribute in the last few seconds?
Yeah, absolutely. I think the message to the decision makers and policymakers in the audience is that the cost of inaction comes not only at the cost of the well-being of adolescents now, but also for future generations. So we must invest now, and that's what young people do.
Thank you. Must invest now. And this is an investment. It's not a cost. Well, it is a cost, but what a bargain. So there's the negative of we can't not do it, but there's the wonderful good news that this will unlock, as Don said, human capital and a range of other things. Dan, any final thoughts?
Yes, we've done many of these investment cases, and some of them just stop with the report, the launch of a report, and of course that's a missed opportunity. So it's really important to follow up the words and the numbers with action, and that means specifically working with not just people working in ministries of health and education, but also with planning and finance. Engage those people in ministries because they're the ones who often are holding the keys to the kingdom. You know, and using this kind of information in priority setting and planning processes. I know that sounds very bureaucratic, but it's important.
No, it is important. Thank you, Dan. And of course, this is just the interim report. By the end of the year, we'll have the full report with some models which can be field tested in individual member states. And of course, we're taking this to UN bodies, to the G7, to the G20. We hope to the COP28 meeting in December, which is for the first time actually has a day on health. And so this is just the beginning. Nee, did you have any final thoughts?
Yes, for me, I believe that I hope that the report can reach out to as many audience as possible, and so that many positive change can be made so that we can ensure that adolescents can live in a healthy and inclusive and respectful world. Thank you.
Thank you. And that's a message for us all. Tweet this, get it on the social media, send it to your network. Say you've been to this wonderful meeting. It's a game changer. We need this message to be got out there loud and clear. Mona.
Thank you, Mark. And just to echo your point that this analysis is relevant for everyone. Governments need to consider adolescents as more than just in the wider childhood age group. Age disaggregation, gender-sensitive intervention is needed for this age group. Not to mention how youth-led movements can use this to demand more investments with a strong foundation of evidence behind them. Even us as a research team, this analysis has inspired us to look further into the return of investment in multi-sectoral programming led by Dr. William Redgard. And just to end with, invest, indeed we must. Thank you so much, Mark.
Thank you so much. Don, literally 20 seconds. Any thoughts?
Yeah,
wisdom.
Just to say, we've already known that this is a massively neglected group in terms of human rights, especially gender, equity and ethics. But now we know that there's real investment opportunities in supporting all of those things. That's the storyline we need to be much clearer on.
Thank you very much. I must thank the panel for their fantastic contributions and for keeping so wonderfully to time. This is just the beginning. Get this message out there. Invest, we must, for adolescent health and well-being in the future. Thank you all very much for joining us.